The Correctional Services Department has announced that 19,000 prisoners will be released to ease overcrowding and thereby curb the spread of the coronavirus. Justice Minister Ronald Lamola says there are 172 cases of COVID-19 in the country's detention facilities. The system is faced with the challenge of maintaining social distancing at prisons, which are overcrowded. The parolees, who Lamola categorized as low-risk inmates, will be released over the next 10 weeks. Minister Ronald Lamola joins us now via Skype, I think, to chat to us about this. Minister, this is via Zoom, I beg your pardon. Minister, thanks so much for joining us.
Thank you and good morning to the viewers.
Minister, please could I begin by asking you to define what low-risk inmate actually is?
The low-risk inmates, how we have defined them, are the people that will be finishing their term or their prison days will be expiring in the next 5 years. So as we speak, in the next 1 or 2 years, we have got about 14,393 inmates whom will anyway are going to parole. So what we have done, or this dispensation, what it has done, it has just said the president has allowed us to bring forward for their considerations of parole. People who will be going to parole in the next 6 months, in the next 3 months, who will be going to parole in the next. What this means is that it has just been brought forward that they can now be considered for parole. And the additional number that could be going into parole in the next, between the next 1 year and within the next 5 years, which is a number of about 4,500 that the president has announced. So it's a number that already they have run through the course. It's just that their dates of considerations are coming near. So we said it's better we bring it forward and we attend to them going to the parole boards to ease the congestion in our facilities, to allow for circulation of oxygen, but also to allow the capability of the system to handle it as and when there is a positive case. For example, with the Eastern Cape in East London, when there was a positive case of an official and some of the inmates, we had to test about 2,137 inmates at a go within a week, which obviously overstretches our system. It also overstretches the health system. We did the same with the Western Cape in Worcester, where we had to test about 340 inmates. So you can see that these are the small centers like the East London one. But if this kind of a situation, we will find ourselves, for example, in one of our management area, which is Johannesburg. As we speak, it has got a number of inmates at 10,155. So if one inmate tests positive in any of the section, we will have to test as many as possible. So this is aimed to allow the system not to be overstretched, to also ease the burden on both the department and also the health system.
Yeah. So, Minister, when we look at these that are going to be eligible to special relief or special parole, that they can get out earlier, what are the conditions attached to the special parole?
The conditions will, firstly, will be that we have learned lessons with the previous paroles, where the people will get out there and commit heinous crimes. What we have said is that what we have learned in the Western Cape is that the inmates, there must be full information which is comprehensive put before the parole boards, which information comes even from the South African Police Service, including our own internal social workers, psychologists, professionals, to assess the inmates, whether they are ready for parole or not, and those conditions. They must deal with the individual risk profile of these inmates. And that is the information that will be in front of the parole board. So obviously the first condition is that the inmate must have a proof of address, and that inmate should be somebody who can be able to take care of them in their respective places where they will be going. If that situation is not available, then we can look at the halfway houses. But the first one is the proof of address, and that there should be conditions that are placed in terms of them reporting. But obviously within the conditions as are currently prevailing in lockdown 4. And those conditions could also include, depending on the assessment of the parole board, issues of community service and so forth.
Yeah.
But those also will be guided by what is permissible within the current regulations of the lockdown.
So you mentioned, I know the line is not that great, but obviously a lot of, or some of these inmates are homeless, and you'll say that they'll go to a halfway house. But perhaps you can give us a little bit more information on that. What happens to those that don't have a residence?
Yes, those that do not have a residence, as I've said, is the halfway house. A halfway house is something in between our correctional facility and the community or a person's place of residence, where we will then take you to, which is still managed by the Department of Correctional Services in conjunction with other partners, where the inmate could be residing for a particular period up until he or she is able to find alternative accommodation or an address, or somebody offering like a relative or someone who might be close to that person.
So, you know, with the current challenges of unemployment and most families now depending on grants, is there a provision to that effect, or will they just come out and join the queues for food parcels?
Obviously, the condition is that if there are such challenges, we work with, as I've said, with the social workers in the department, but those social workers are also integrated, working with the Department of Social Development, which then assesses the inmate situation. And if the situation may need some kind of food parcels, indeed that could be the situation. But most of the inmates, as they have been working inside the centers and various platforms of agriculture or some of our production facilities, they will have something which is a starter pack. Although it's not a big amount, but they will have something which they have worked for over the years.
Have these inmates, the 19,000 that you're referring to, have they all been tested for COVID-19? And one would imagine that they'd go through a 2-week quarantine process before they're incorporated back into society. And because a lot of people are very, very worried about this, not only in terms of spreading the virus, but also, you know, are these prisoners rehabilitated? Are they ready to come back?
Now, obviously, those that have been tested, as I've said, we have given the numbers in East London. They have been tested, all of them. And in the other areas, they've been screening. And all that have tested positive, obviously, will have to remain. They can only go out if they have tested negative. With regard to the rehabilitation, every inmate, upon arrival, they go through a profile assessment, which then takes them into a rehabilitation course. And that rehabilitation course is aimed to modify their conduct and behavior. There have been challenges with that, we do admit. But we are of the view that they have undergone a minimum kind of training with that rehabilitation. And with our assessment is that the majority of the inmates that are mostly released through this kind of programs, they usually do not re-offend, but 1 or 2 of them do commit some of the re-offend. And unfortunately, those then gives a very bad name for the entire system. So we have to, we're also worried about that, because whoever re-offend, one is too many for the system. Hence, we are continuously improving it, working with various stakeholders so that our rehabilitation programs does yield the results that we expect from the inmates.
Yeah. You know, I mean, again, I bring up the fears of society for allowing these offenders to go back into South Africa and, you know, reoffend. As you have said yourself, there are those instances where you do find that the offenders do reoffend. But under normal circumstances, the grounds for parole, as we understand them, of a convicted prisoner would be for them to prove that they've been rehabilitated, which you've addressed, that they show remorse and take accountability for their actions. I mean, are you as a department going to be able to establish all of this on this amount of inmates before they're released?
Yeah, obviously, firstly, Leanne, is that the concerns of society, indeed, they are genuine, and there has been such incidences. But I think what we should take is that anyway, these inmates are going to be released, and they were going to be released in the next 1 year, or in the next 6 months, some of them, or in the next 3 months. Anyway, what we have just done was to bring it forward to allow them to undergo the process of being considered for parole. Obviously, the parole boards within the next 10 weeks, as you have seen, government in the past 1 year, 1 week, 1 month or so since the state of disaster has to work differently, has to work with speed. And even in this instance, the parole boards will have to cut their socks out and work differently and ensure that everyone undergoes the process, is being seen, the process is due and thorough, and the police participate, the psychologists, the social workers. It is within the current context of the Disaster Management Act. You have seen water tanks being delivered across the country with speed. We also do not have chance nor the luxury of time. It has to be done, and it must be thorough, and all procedures have to be followed.
You know, Minister, previously you yourself have said that the parole system is broken. You know, and this is it's a big concern. I mean, for example, let's just take a look at the just real Bob Hewitt case. I mean, there was concern that this process failed the victims, and the victims really are not having a say in all of this as to who is given parole and who isn't. And, you know, their safety is also at risk over here. So, I mean, let's talk to that example.
Yes, we did say that, and you will remember on the Bob Hewitt case, I did intervene, and the process was redone with the inputs of the victims. And we have also learned, as I've said, as we speak now, there's a pilot project going on in the Western Cape on the lessons that have been learned on the system that was broken, as we have said. But those lessons we are now going to build them in this process that the parole boards are going to undergo. And one of the lessons was that the police needs to get the file in advance and do a risk profile and be able to make their submissions before the parole boards. And that we also need various experts' advice like criminologists, psychologists in the process. So those are the lessons that we're beginning to gradually put into the system. And as we move forward, those are what we are going to ensure that they do become part of the system.
Yeah. Just to get back to that Bob Hewitt story, we interviewed Olivia Jusriel recently, and she was on the show explaining how unhappy she was with the Bob Hewitt parole. Has she contacted you regarding this? Is this on your radar at all?
Remember, we did our part in terms of what the Correctional Services Act allows us to do, which was to intervene when we became aware that they were not aware nor consulted before the parole was done. And when we intervened, the parole board did call them, and I think they participated in the last round of the parole process, and the outcomes was communicated to them. So at this stage, in terms of the Correctional Services Act, we have done what the Act expected us to do, including to intervene when it was necessary.
All right, Minister, just on a closing note, I think just to reassure South Africans, and, you know, there are obviously limits to who is given parole. And it's important to note that, you know, from what I'm reading as well, is that those that have been sentenced to obviously life imprisonment, those that are serious crimes, sexual offences, murder, attempted murder, gender-based violence, child abuse, they are not eligible for parole. Am I correct in saying that?
Yes, you are correct. Those are part of the exclusion, and whoever is going to undergo the current process, there will be due processes. They are going to go in front of the parole boards, and anyway, these are people, as I've said, who in the next 3 months, 1 year, or in the next period, were anyway going to undergo the process of parole. Their sentences are approaching the expiry or towards the end. Okay. So that is the category that we have looked into, and we believe that bringing it forward, it helps the health system, it helps ourselves also to manage the virus within our facilities, but also as and when somebody tests positive, it enables us to be able to not to be overwhelmed in the system, including overwhelming the health system.
All right, Minister, thank you for your time. Thanks so much for talking to us. That was Justice Minister Ronald Lamola clarifying the reasons and process relating to the decision by the Department of Correctional Services to release 19,000 inmates due to COVID-19 to curb overcrowding in our prisons.